I think the first step on a sleep journey, if you're somebody who is interested in your sleep health, I think the first step is determining whether or not your sleep is good. I think that if you were a swimmer and you went to a pool and found a swim coach, my guess is the first thing they would do is say, okay, jump in the water and swim a few laps and let me see what I'm working with here. And if you jumped in and sank to the bottom of the pool, that would put you in a certain course. Or maybe you would work with a different coach to get you buoyant. If you got in and swam some really quick laps, like kind of elite high school level, okay, oh, you're a very good swimmer. We have some fine tuning to do. And I think about those different swimmers as they relate to sleepers, that if you're the person who jumps into the pool and sinks to the bottom, working on the entry angle of your elbow as it comes through on your freestyle is not where we start. That is miles down the line or meters down the line if we're in a pool. It's irrelevant. It's not that it's not important, but that's not going to move the needle as to whether you can float or not. And unfortunately, I feel like the media really concentrates on that stroke angle elbow thing in terms of let's make sure that, you're supplementing your magnesium. Okay, sure, magnesium, brains love magnesium. That's a very important thing. But you're saying to me, you get in bed and it takes you hours to fall asleep. I don't think magnesium is going to help you unless you fill a bag full of it, drop it on your head. So we have to kind of identify that starting point. So unfortunately, I think in our culture, and that extends beyond the United States, if you talk to a bunch of people about how do you sleep, are you a good sleeper or a bad sleeper? And I used to do this in lectures, and I always found it really fascinating. Raise your hand if you're a bad sleeper. And if somebody raised their hand, you ask them, why have you made that decision about yourself? This black or white decision, binary, 1 or 0, you decided bad. Why? The answers were usually one of two. The first is it takes me a very long time to fall asleep. That's the first answer. The second answer is I often awaken during the night, and there's usually some sort of variable in terms of I sometimes fall asleep very quickly after I wake up and go to the bathroom. Other times it takes me a long time to get back to sleep. So it's usually something around the concept of sleep efficiency. How much time are you spending in bed as a proportion of how much you're sleeping? And if it's not, I get in bed, immediately fall asleep, and never wake up, then that was often interpreted as being bad sleep. And I think that's a difficult and problematic way to define sleep, because that's not really how sleep works. It's almost like trying to determine, if you had a group of people, who's starving and who's not, and you ask them, hey, would anybody in here like a sandwich? The people who snatch the sandwich out of your hand and immediately eat it without taking the wrapper off, you're determining those people to be the good eaters, the fed people, when in fact, their drive for that food is actually indicating something's either wrong with the quality or quantity of what they're consuming. So when you look at an individual, I sort of divide them maybe into 2 or 3 groups: the groups that are excessively sleepy, the ones that get into bed and never have trouble falling asleep. They're out cold immediately. The group maybe that gets in bed and struggles with those 2 metrics that we talked about, takes them a while to fall asleep, maybe wake up in the night and have trouble getting back to sleep. There's probably a third group that we see in our clinic, which is they've identified themselves as being pretty good sleepers. They want to take it beyond good sleep. They want to have elite sleep, like the biohackers, I've always liked I work with a bunch of athletes. I always like working with triathletes. Hey, I got this saddle for your bike that weighs 0.2 grams less than the one you currently have. It's only $3,000 more than the one you've got right now. I'll sell it to you. They'll buy it. Anything to make their bike a little lighter. They're wonderful sleep patients because they'll do anything you ask them to do. So when you think about those first 2 groups, can't fall asleep and can't stay awake, it's really the can't stay awake people that are concerning. So if you think about an individual who is getting into bed lovely bed, it's dark, quiet, cool, and it's taking them a while to fall asleep, that's not a great indication that you're deficient in sleep. Were you deficient in sleep, you'd probably fall asleep quickly. If you're deficient in food, you're hungry. If you're deficient in water, you get thirsty. So, probably the better metric to start off with is in the afternoon in a comfortable chair, how hard is it for you to stay awake? Do you ever nod off on an airplane? Do you fall asleep at stoplights? Have you stopped going to religious services because when you go, it's embarrassing because you always nod off? That might be the better measuring stick for what's the nature of your sleep like. And if somebody says to me, no, I've got great energy during the day. I read very boring reports all day long at my job, and I sit at a cubicle with no window, and I can sit there and read those reports quite easily and would never fall asleep. In fact, a lot of patients who are actually fairly good sleepers will tell you things like, I can't nap. And they're saying it like it's a bad thing, like there's something wrong with them. Like, I'm so exhausted and I sit down and I can't nap. What do you think that means? That you find a comfortable position and stretch out and you can't fall asleep? Do you think that indicates that you're not getting enough sleep? Or do you think maybe it indicates the sleep tank's full? And so that's where I would probably start off with in your sleep quest in terms of, let's forget about how long it takes you to fall asleep. And let's forget about your sleep continuity during the night. And maybe first of all, focus on, how do you feel during the day? What does that feel like to you? I've got great energy. How would people describe your energy, your family, your coworkers, your friends? Oh man, there's so much energy. Like they work circles around me. If you were to name the 3 people at your office that are the sleepiest, would you be one of those people if there was a secret survey that went around the cubicles? So that's a great place to start. And if somebody says, look, I feel quite great, then maybe going backwards to the first question, okay, great, I'm glad you feel good. Tell me about how long it takes you to fall asleep and how your sleep feels. And if the answer is, takes me 10, 15, 20 minutes to fall asleep, maybe sometimes longer. I wake up a couple times during the night. Sometimes I'll wake up and it takes me a little while to get back to sleep. I think that's normal. I think all of those statements are well within what a bunch of sleep doctors, if we were sitting around, would consider to be perfectly fine. This idea that if you're in bed longer than 5 minutes awake is it's a problem, itself a problem. I tell people all the time, if somebody said, look, give a 1-sentence lecture about sleep quality, it would probably be something like, feeling as comfortable in bed awake as you are asleep is probably the secret to great health or great sleep. I get into bed, I'll fall asleep quickly or I don't. It doesn't really matter to me. I like being in bed awake. It's not a terrible situation for me to be in. So if you're working from the situation of, hey, I don't feel good during the day, my energy is not great. And I think that's where I really like to dive in with my patients